Well, here's a video I've been wanting to make for weeks now, and then I got hit with COVID, and believe me, I would much rather have had the vaccine because COVID is not fun, but I'm back now trying to see if I can get my strength up to start doing videos again. So this one shouldn't take too long, so it shouldn't be a bad one to start off with, just to see if I can do it. Before I get started, let me do the begging for money segment because I really need it, because like I said, I've been down for the count for weeks. So over here, you can see all the different ways that you can support the channel, all the places you can find me. There's YouTube, BitTube, Library, and Odyssey, and then you can donate on PayPal, Patreon, and Subscribestar. All those links are below. You can also join the conversation at discord.bogosity.tv and the Lord Killian Discord. There's a short link there to it. And all of the donation can be done at donate.bogosity.tv. All sorts of different ways to donate, including crypto. And there's also the special little QR crypto code over here. Can I talk? Does COVID take away your ability to talk, or is that just me? I think this might just be me. But anyway, that's when you can scan with any wallet that supports it and donate with pretty much any cryptocurrency you want. And also, I put the Streamlabs link over there as well. The nice thing about that is you can do donations and super chats whenever I'm on the live stream. And unlike YouTube, Streamlabs doesn't take anything out of it. They pass everything 100% my way. And also, please like, subscribe, the bell, comments for the comment god. All of it's appreciated. All of it helps. So, let's talk about the Pfizer-Biontech COVID-19 vaccine, because there's been a lot of talk about this. A lot of people in the Discord have been expressing their concerns with it. And of course, everywhere else you have all the crazy stuff you normally get with vaccines, and how they don't trust the government, and it's some secret plot to, inject us with microchips or something like that. Those microchips are like really big. They'd never fit in one of those needles. And just think about, how much you would have to go through to try to make this into a conspiracy. It just wouldn't work. So we'll go over the ingredients, what's actually in the vaccine. And I think you'll find there's really nothing to be concerned about, with maybe one exception, but we'll get there. But we'll start off with this active ingredient. And you see there, that's BNT162B2 blah, 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 blah. What the heck is that? That is the messenger RNA for the COVID spike protein. So you've seen those images of SARS-CoV-2. They've got all those little jutty-outy things on them, little spikes. That is how they gain entry to the cell. They bind with the ACE2 receptor and enter into the cell, and then turn the virus's RNA into messenger RNA, which the cell is then tricked into duplicating and making copies of the virus. So the way this works is it's just the messenger RNA for the spike protein. And so your cells make the spike protein, and then your immune system attacks the spike protein. And so it's not even the whole virus. There's no way you could possibly get a virus from this. It's just the spike proteins. But your immune system learns how to make antibodies to bind to them and make them inert. And so when you get the actual SARS-CoV-2 in your system, your immune system is just going to surround them and bind to all those spikes, and it won't be able to enter the cell. And I think it's a really clever way of doing it. Because ordinarily, if you want to do like a live attenuated or a killed virus vaccine or something like that, you need to set up this whole big virology lab or work with one or whatever, and it's expensive, and there are tons of precautions you have to take and things like that. Here, all you have to do is contact one of the firms that have the genetic code of the virus and say, hey, can you email us the RNA for the spike protein? Yeah, just send us that in an email. They just email it to you, and then you just print out the spike protein, and that's it. That's all it is. So the rest of these are inactive ingredients, but don't let that kid you into thinking they don't do anything. They are important. The first one is Lipid ALC-0159, and if you should worry about any ingredients, it should be this one. The purpose of this lipid is to work as an adjuvant. It kind of kicks the immune system into gear. It kind of fakes it to your body and says, hey, you've just got this disease that you need to fight off. And so our immune system says, okay, well, we need to make antibodies for these spike proteins, and that's how the vaccine works. Well, there have been rare occasions where people who have gotten this vaccine have had a problem with anaphylaxis. Because an allergic reaction is basically your immune system going haywire and attacking things it shouldn't be attacking. So when this adjuvant kicks the immune system into gear, if you have a specific allergy and it's sensitive enough, I mean, there's like a couple hundred micrograms of it, I think. It's not that much. You would have to have a very sensitive allergy to be done. But some people have that, as we've seen, and, they've gone into anaphylaxis and they've needed, the EpiPen, in the chest and everything, things that they do. So if you're at all concerned about this, talk to your doctor, and your doctor can make sure that you're taking it in a safe environment where there's, enough of the EpiPens and things like that to help you with that. Or if he thinks it's severe enough, he might advise you not to take it. I don't imagine that's very many people, and we only need like 60 or 70% for full herd immunity. So the few people who would have that big of an allergic reaction, I think it's kind of fine if you don't do that, but talk to your doctor. Most of us, well over 99% of us, won't have to worry about that. Because you'd have to have the right kind of allergy. It would have to be really sensitive, so I wouldn't sweat it myself. But if you've got a history of anaphylaxis, please talk to your doctor. All right, the next ingredient is another lipid. This is ALC-0315. I don't think there are any problems with allergies to this one. This one is really cool. If you just put RNA in your body's immediately going to break it down and say, hey, there's parts of this I can use, and just scavenge it for parts. And we don't want that. We need it to stay intact for a little while so that the vaccine can do its job. So this lipid, you can give it either a positive or a negative charge, and I believe the spike protein is negatively charged. So they give this lipid a positive charge, and it binds to the spike protein, the mRNA for the spike protein. And so that kind of holds it in place and protects it from your body until the vaccine can do its work. So the next four are salts. There's sodium chloride, ordinary table salt, potassium chloride. If your doctor has ever told you that you need to cut down on sodium, and so you buy that salt substitute at the store, that's potassium chloride. And the other two are salts that your body constantly makes and breaks down in the course of balancing its pH, which is what these are for. They're there to balance the pH of the vaccine to make it match the pH of the body. Because if it's too acidic, then it ends up being like, putting lemon juice on a paper cut. Or if it goes the other way and it's too alkaline, it's more like caustic soda. So that's what that's for. And then the last one we have is sucrose. That's just good old table sugar. And it's there to hold everything stable because there are no preservatives in this. And because of that second lipid, the way it works, you need to store this at like negative 70 degrees Celsius. And so you need sucrose to hold it stable at that temperature. So then what happens is once it's at room temperature, they have to use it within I think 3 or 4 hours. And the pharmacist has to mix it up. And there's instructions, and I'll give you a link to this that I'm using. This is a page on the National Institutes of Health that's basically the little insert from the FDA about the vaccine and how it works. But it's got instructions for the pharmacists on how to actually mix up the vaccine, how much saline you mix it with, and things like that. And then they put it into the needle, and then they have a few hours to inject someone with it before it goes bad. So that's basically how this works. And so as you can see, there's no dead babies in here. There are no microchips. Imagine what you would actually have to go through to have this be some kind of plot to put in microchips. Because remember, the pharmacists and the doctor's offices, they're preparing each and every dose. And, they've got the tiny little needles, and, those RFID chips are pretty big. They're a little bit bigger than a grain of rice. So, that they would notice it. They'd notice it. As we've talked about before, if your conspiracy involves more than a couple dozen people, there's this huge likelihood that you're going to have a whistleblower. And so you better not even try it. If your conspiracy requires 200 people to stay silent, then it's impossible. Not even going to happen. Well, there are probably 200 people in your area that would have to be in on the conspiracy in order for them to put microchips in this thing. Or putting things in it that make women sterile or other crazy things that they're doing. Because if they have to make each and every dose themselves, right? How many clinics are in your area? Right? So what's that? 3 or 4 doctors per clinic and maybe 10 nurses or a little more. Okay, so basically 15 people per clinic who would have to be in on it. 10 clinics in your area, there's 150 people. Conspiracy is already impossible. Not counting the hospitals, not counting all the pharmacies. Walgreens, CVS, the Walmart pharmacy, the Target pharmacy, all those pharmacies. Yeah, there's hundreds of people just in your area who would have to be in on the conspiracy in order to make that work, let alone all over the world. There would have been a whistleblower. If they were slipping anything else into this vaccine, there would be whistleblowers. There's no way around it. So yeah, hopefully that takes care of the crazy conspiracy theories about this. Please, everyone, get this vaccine when it comes out, because trust me, you do not want the real thing. Living proof right here. You don't want it. Nope. Don't worry about it. Get the vaccine. If you are at all worried about an allergic reaction, if you're prone to anaphylaxis, if you're very sensitive, talk to your doctor. That's really the best thing to do, but most of us won't have to worry about it. So thank you so much. Like I said at the beginning, donate.bogosity.tv will help keep this channel going. And you can donate through PayPal or all sorts of cryptocurrencies. You can also become a regular supporter at Patreon and Subscribestar and get videos like this early and unedited. And you get to see what happens when I have to stop recording for a second and just do something. Yeah, it's been, I'm dragging here. Yeah, it's been fun, but yeah, I'm starting to get back into it. This was kind of a short one, but I'm starting to feel like I can get more into this. So thank you so much for supporting all of that at donate.bogosity.tv. Please join the Discord, and check me out on all the alternative places. There's BitTube, Library, Odyssey, all of those, just in case I get, caught up in this latest bit of, YouTube banning, where they're banning people. It's like, why are you? There was like one that was like a Linux developer. They bet. It's like, why did you do him? I don't know. It's crazy stuff. Crazy. So, thank you so much for your support. Thank you for watching. Until next time, stay strong and be free.